Hello, I welcome you all into today's presentation in the workshop of Basics of Epidemiology. Thanks to BIMSSCON, and I am Dr. Muhammad Tareque Hasan, and I have worked in the Department of Epidemiology, Bangladesh University of Health Sciences, which is situated in the Mirpur. Now, currently, I am studying at the University of Eastern Finland, Public Health. So let's go and see the slides of the basics of epidemiology. And I thank you all for the participation in this workshop. So this is the basics of epidemiology. And so what is our learning objective? What is epidemiology? And understanding the key points of epidemiology, uses of epidemiology, basic study design. So this is the main top objectives of this workshop. Now, without definition of the epidemiology, we cannot go further ahead. If we want to know the epidemiology, we have to know the definition. And you all know in the public health sector, there is always a definition. Just like that, in the public health sector, epidemiology is the core subject. If you want to do a career in this public health sector, you have to know the epidemiology. Other than that, if you want to do some research in clinical health sector or any other health related sector, you should have a good idea of the epidemiology. Without this idea, you cannot have a good conception of the research. That's the main objectives, and I will try my best within this time period so that you can have a hunch of this idea from that. So let's see. Now this is the definition. So epi means upon, in people, and demos we say about the people. Ology is the science of study. So epidemiology is the science of the study of epidemic. Now this is a Latin word. From there this epidemiology comes, and it is one of the scientific method of the disease investigation. That's mean here you will investigate how the disease was occurred, why it is affecting the society, how we can prevent it, and this is the main purpose of the epidemiology. And this thing is correspond with the biostatistics and medicine, because in the epidemiology there are some statistical analysis which shows the relationship between one disease or any event. So you should have a good conception of the biostatistics, and this biostatistics is another branch of the statistics which deals with the biological science. So you already know what is medicine, and because you're all of are you are the uh, graduates or studying the medical science, MBBS or dentistry. Now let's see the main slide. Now this is the main definition from the WHO book. Epidemiology is the study of the distribution and determinants of related states or events in a specified population and the application of the study in the control of health problems. Just like I said, every public health subject has a definition. So you can see it is that thing. And it is not that much difficult to memorize. But if you want to remember this definition, I will say you have to focus on few words. That's the main objective of this definition. And if you can understand the use of these words, then you can easily know the epidemiological use. So here you can see I have bold the study, distribution, determinants, and related state of events, specified population, and application. These are the main keywords of the epidemiology definition. And if you want to do a career in the epidemiology, you should have good conception of these words. Now, a little bit example: national and local surveillance system, cancer injury, AIDS, occurs of E. coli. In this way, how we can define epidemiology? There are some study design or study to investigate the association of cell phone use and the development of brain tumor. So in this study, we should investigate what is the main relationship between the brain tumor development with the use of cell phones. Cell phones, that's mean the mobile phones. And we all know there are some radiation effects due to use of this mobile, because here we are using 3G or 4G services, and they use a high velocity of this transmission, and this transmission comes to our mobile phone. That's the reason we are saying that development of brain tumor is possible. So the key points which I say: study, distribution, determinants, health states of events, and application. Now study. You all know study what is. Study, we say it is the education process, but here study implies sound method of scientific investigation. Contribution factor of epidemiological include advances in biology, medicine, statistics, and social and behavioral sciences. Now, in a short term, I will say it is a scientific investigation process. There are many processes by which we can do epidemiological study. So this is the scientific investigation process, which will mean study. Now, distribution. Distribution refers to the frequency and pattern of health states and events. Frequency is the number of occurrence of health states of events, and pattern involves presenting the distribution by person, place, and time. So let's make it more clear. We all know what is distribution. Distribution, if we want to say, it means how it is distributed. Suppose if I am a medical doctor working in the government sector, now government will distribute me according to the place where number of doctor is less. Now if I can see the number of doctor is less in north part of our country, in Chapainawabganj or something like that in the Rangpur. Now, government will distribute me in the Rangpur district or in the Chapainawabganj. This is the distribution. Now, frequency. Frequency refers to the number. This means how many people are affected or how many patient is there. How many population we will take for our study purpose. Now, this is the pattern. And we all know in the PowerPoint template, it generally shows PPT. So that's mean person, place, and time. This is the tricky part. So the person pattern means who are mainly affected, which area is affected, and when. So person, this is the who, and place, which place is affected, time is when. We all know in the winter season, most of us suffer from the running nose. So here person is most of the general population. Place in Bangladesh. Time in the winter season. Now we can say many children suffers from diarrhea in summer. So children are the person. Place, we are specifying the whole country of Bangladesh. And the place is Bangladesh. Time in the rainy season. So the rainy season is the time. In this way, distribution occurs. Now, determinants. Determinants are the factor that produce an effect, result, or consequences in another factor. Determinant is a cause. In a short term, we can say it is the cause which causes the disease. Now, we all know we are all suffering from the pandemic disease, it is the COVID-19. So for the COVID-19, there is the virus, the COVID virus, which is causing this disease. Then if we think about the food poisoning is generally caused by the Salmonella or Shigella or enterohemorrhagic E. coli. So these are the main cause. Again, if we think about the hypertension or diabetes mellitus, we have read the type A personality, or eating more carbohydrate or sugar containing products. This thing causes hypertension or diabetes mellitus. These are the risk factors. So risk factors or any causative agent are the determinants. Health related states of events. So health related states of events refers to the fact that epidemiology involves more than just the study of disease states, but also includes study or events, behavior, and condition associated with health. Now, think about the COVID. This is causing the disease COVID, COVID-19. This is the COVID-19 disease. Now, Salmonella causes diarrhea. Enterohemorrhagic E. coli causes bloody diarrhea. Then think about the any viral that causes the viral fever. So these events are the disease such as diarrhea, then the fever, then this COVID-19. This is the health state of events. Now application. So we all know what is application. Application in a short term we can say it is the use. So application refers to the fact that the information obtained through epidemiology applied to better prevent and control health problems. Suppose we all know physical exercise may enhance your life expectancy. This is the research finding. So every day if you do leisure time physical exercise, your life expectancy will be increased. In Finland, because I am studying in University of Eastern Finland, here physical exercise shows their life expectancy has increased more than tenfold. That means it is a huge achievement. Now, if we use this physical exercise for the life enhancement, then that will be the application. In what I have seen here, every people do physical exercise regularly, even in the morning or the evening, and they are doing pretty good. Later, if you think about the vaccination, vaccination decreases the many disease from removes many disease from the society. So, if we think about that, we can say the vaccine is a we are using this vaccine regularly in Bangladesh. There's a vaccine campaign program every day. So and there's also vaccine month. There's a vitamin A capsule which removes night blindness. We all know. Now we are application is the by the vaccination program to remove this disease process. So these are the main part of the epidemiology. Now what I say distribution little bit discussed here, the frequency and pattern of health events. So frequency is not only the number of health events which I said earlier and the number of cases meningitis or diabetes population, but also the relationship of that number with the size of population. Now how many people are affected in that population, that is the size. And in this way we will say that in Bangladesh around 200,000 people are affected by the COVID-19, but our population is around 180 million. So from 180 million, this is population, and only 200,000 people are affected. This is the size of that COVID number patients, and our population number is 180 million. This is we are saying about the frequency. Again, we have told about the pattern. This is the place, person, and time. So person who are mainly affected, this is the suppose for the COVID patient, we are saying the elder group will morely affected. And place, it is now globally pandemic now and everyone is affected, and time, this is the whole year. But if we think about the running nose, generally middle age or maybe the younger generation between 15 to 30, they are mainly affected. So the person is this middle-aged group or between the young generation, and place, it is I am saying about the Bangladesh, and time, this is in the winter season. Now this is maybe some changes due to place, maybe changes due to geographical variation, urban or rural differences, location, work site. Suppose a person is working in the coal mine. So coal mine is the place there is some coal that enters into the lung that may cause a lung cancer, and some people are working in the asbestos area, then that enters into lung, it can causes the asbestosis. This is the place and time that may be seasonal, weekly, daily. It depends on the place where you work and the time schedule. And we also know there are some illness or disease which is related to the gender, age group, marital status, and this is disease related to the gender group. If we say is prostate cancer, prostate cancer only occurs in the male, or cervical cancer only occurs in the female. This is the thing. There are some changes in the behavior with the, if your behavior is good, and some disease is related to the behavior or maybe sexual behavior, something like that. So this is the pattern how it is affecting, and it is under the distribution. Now determinants, as a short term I have said this is the cause. Now there are many types of determinants. It may be physical stress, chemical determinants, biological and psychological. So we all know the excessive heat, then the excessive cold, the excessive heat called the heat trauma, then the cold, excessive exposure to cold, there is something called the frozen shoulder, or maybe sometimes there is a gangrene, and noise, by the excessive noise exposure. Sometimes we lost our hearing, radiation exposure causes cancer, climate change. This is another devastating in the all over the world, and there's also the housing and many more. If we talk about the chemicals, drug, acid, alkali, poisons, we all know what can poison do, and we have already seen many poisonous cases during our internship or our third year of medical life. Now, some certain drugs causes drugs poisoning. We all know about that, and all the infectious agent such as the biological agent, microbiological agents such as the virus, bacteria, parasite, they're all causing the diseases. So they are the cause. This is the determinant. And recently there is another factor. This is a psychological factor, a mental health. So everyone has some mental issues, and we should think about that how we can help them. And you will know that in the European countries or in the developed world, mental health is a great issue. And I think in my country, the Bangladesh, we are also facing that. So we should have think about that thing also. Now, again, I am telling you about the health states of event. So that is suppose a diarrhea or HIV/AIDS, etc. And I have also discussed about this application process, how we can use it to improve our healthy lifestyle. Now this is the main example. Assessment of the distribution of under 5 children diarrheal disease due to rotavirus in the Midput area at 2017. This is a good example. It's easy to understand. Assessment of the distribution of under 5 children diarrheal disease due to rotavirus in the Midput area at 2017. If we look at this example, here first we have discussed about the study, and here I have said it will be a cross-sectional, and there are many study designs in epidemiology. I have just write the main one, which one is I'm going to do for this distribution, which I have said here person is under 5 children, place is Mirpur area, and the time period is 2017. Determinants, I have focused on rotavirus. Here's rotavirus, health-related event, diarrheal disease, and application. After generating the knowledge about rotavirus outbreak, the research will imply the measures to control the outbreak. So this is the way how epidemiology works. The main thing is it plays the central role in carrying out the three core public health functions. There are many functions in the public health, but what does epidemiology do? It provides an approach to assess and monitor the health of population at risk. So the population who are at risk, if the previous slide example, we can say the under 5 children are mostly in the risk, and here we want to find out how we can monitor these children. Then health problems, what are the priorities we can make, and basis for predicting the effect of certain exposure. Suppose what is the exposure of this radiation, what will be the effect of our lifestyle, what will be the effect on our life. This thing we want to predict. We are taking table salt regularly, what will be the effect of excess consumption of table salt. This thing we want to measure. This thing is mainly done by this epidemiology. These are the main three functions. There are many more functions, but these are the main three basic functions for the epidemiology. Now, this is little bit extension of the epidemiology, and epidemiology is based on the study design, which I have told. So, what is study design? A study design is a specific plan or protocol for conducting the study, which allows the investigator to translate the conceptual hypothesis into an operational one. This definition is a little bit difficult to understand. Even I am also feeling difficult to understand that. So let me explain in a short way and easily understandable. This is a scientific investigation process. Without the scientific investigation, we cannot develop any research project or any research. So it is a scientific investigation process by which we do the research, and this research is mainly based for the health related study. This is the easiest definition. This is the definition from the book, but that is the main. And there were development of some hypothesis. So we'll discuss about it if there is a time. Now, there are many types of study design. Someone says quantitative, qualitative, there are many. But this is the mainly from easy to understandable, and this is the quantitative study design, and this I have taken from the WHO book of epidemiology, which is accepted all over the world. So let's see what is types of study design, because in the epidemiology most of the study designs are quantitative one. That's mean the based on the number one, and these basics of epidemiology were mainly focusing on the quantitative part. So let's see some of the things easy to understandable. So type of study, alternative name, and unit of study. Type means we all know the different types and they all have some alternative names. And unit of study, that's unit mean whom we are taking for our study purpose. First one is observational, another one is experimental. I will discuss about this observational and experimental later on. So observational has two types. One is descriptive, another one is analytical. In the descriptive study, there is a case report, case series, cross-sectional. In the analytical studies, there is ecological, cross-sectional, case control, and cohort. Now, this ecological study also has a name correlational, and cross-sectional has another name prevalence study. Case control is case reference, cohort is follow-up study. Experimental studies, another name was intervention studies. Now, experimental studies again divide into randomized control trial, which also known as clinical trial. There is a field trial and community trial. Community trial also known as the community intervention studies. So everyone, you can see the population level, ecological, it takes the whole population. Cross-sectional unit of studies, it is individual. That's mean in here, individual part of population is selected. Case control, it is the same. In cohort also is the same. Part of population is selected Randomized control trial or clinical trial is generally done over the patients, and in the field trial it is the healthy people who are not affected by the disease. So this thing is also occurs in a community level. Community trial, it suppose in the all communities, suppose there is a community where I have worked. It is in the Raigonj, and Raigonj, suppose it has three areas, subdivided into three areas, and I am working in these three areas. This is the communities. So these three areas will be the community trial. Now in the field trial I am taking the whole population of the Sirajganj, because Raiganj is inside the Sirajganj Upazila. That's why that will be the field trial. The size of this will be the huge. And this case report and case series, case report, it is generally about the one population, one case. Suppose you are telling about the lung cancer of one patient, this is the case report. And when this is about more than 10, maybe 15, 25, but not more than the 50, that will be the case series. Now observational study, another name non-experimental. There is no intervention. The basic difference between the observational study and the experimental study: in the experimental study there should be an intervention. Now what is an intervention? Intervention means anything which you are given to that population. Suppose you are taking two population. In one population you are giving education as an intervention. Another population you are not giving any chance of education. So in this way that will be differentiated. This is the intervention. Or you are giving vaccine in one population, in another population you are not giving any vaccine. So this is the intervention. Another name of observational study is the non-experimental. Treatment and exposure occur in non-controlled way. Now, um, now there are two things. Experimental study, in here you can control the environment. Yes, you are working in a clinical or clinical hospital, something like that. You are making the changes. You are also controlling the environment, surrounding structure, everything. But in the observational study you cannot do that. And here individual can be observed prospectively, retrospectively, or currently. Now that's mean prospectively means forward looking movement. So you are taking some person from today's to 1 year perspective, or if you're looking from today to backward, then that would be the retrospective. And currently, that's when you are looking at now, at right sit now, that will be the currently. Experimental, so in the experimental there will be always a control group. Just like I said before, there is a one group I am giving this intervention like this vaccine, in another group I am not giving any intervention. So that will be the experimental. And research design will be planned. Clinical trial is the most well-known experimental design. Yes, now we all know that there is a COVID situation and there are many clinical trials going on for the vaccination. Let's wait for that, and we really want this vaccine, and we don't want to suffer from this COVID-19. That's true, and this thing is mainly doing by the epidemiologist. Now there are two: descriptive and analytical. Descriptive means describe occur of outcome. Analytical means association between exposure and outcome. These are two difficult words, and I think I can make it more easy. So descriptive, that's mean description. If we want to say this is description, so you are describing something. I am telling around 1000 people were affected by the coronavirus in Dhaka city. I'm just giving description. 500 children will be affected by diarrheal disease. That will be another description. So in this way you can say the descriptive. Analytical. Now in the analytical study, because if we go backwards we can see there are many studies, and you can see this cross section is also present in descriptive and analytical part. So in the analytical part there is always a comparison group. Without the comparison group, that won't be analytical study, and there is always exposure and outcome. So this analytical group may be gender based. Suppose I want to see the comparison between the vaccine in male also in the female. So there is a two compare group on the basis of gender. Or I want to make a vaccine exposure and make the outcome, one in the Dhaka city, another in the suppose in the Kumilla city. So there are two groups, but in the descriptive there will be only one group. I want to see the vaccine exposure outcome only in the Dhaka city. There is no difference. I'm not making two groups, so this is one group. That's why this one is descriptive. So in the analytical there should be a two group, and in the descriptive studies there will be a one group. In the descriptive study we describes only one thing, and analytical we are describing exposure and outcome. So what is exposure and what is outcome? Exposure means by which you are exposed. It may be any vaccine, maybe any biological agent, maybe any climate change, anything by you have been exposed. So if we say, here we can see this under 5 children was exposed by the rotavirus, and his outcome was diarrheal disease. So after exposure, what comes back? This is the outcome. And you can might not say it is a disease all the time, because all the time it is not related to that. So if you expose but the smoking, then the outcome will be lung cancer. If someone is affected by the HIV virus, then his outcome will be AIDS. So this is the difference between exposure and outcome. Now, observational studies we have divided into descriptive and analytical studies. So descriptive studies generate hypothesis, and it answer who, what, where and when. So person, place, time, who are affected, when, this thing is answered by the descriptive studies. And already I said the case report is one patient, then the case series, cross-sectional or correlation studies. It is mainly try to find out the etiology, cause, কিসের কারণে হয়েছে. Tools include person, time, place, and ensure understanding basic dimension of disease. So this dimension mean how it was occur, how people are affected, how many people are affected. So this is the dimension. Analytical studies. Test hypothesis. So in that hypothesis we are telling rotavirus causes diarrhea, but in here we will say, does the rotavirus causes diarrhea? It is true or not? This is the testing the hypothesis, and in that we are telling maybe rotavirus causes hypothesis. We are generating that hypothesis. Here we are telling yes, rotavirus is causing the diarrheal disease. We are testing that hypothesis, yes or not. So why and how the question we try to answer. We are telling the under 5 children are affected by the rotavirus. Why they are affected? This thing we will say, and how. This is analytical. It may be case control, cohort, or cross-section, analytical cross-section. Risk assessment. And this is the main thing, odds ratio, relative risk, and correlation. This is the main thing of the analytical studies, and this is a very good finding if there is any odds ratio or relative rates or correlation coefficient. This is a little bit difficult. And study incidence rate. So incidence means number of new cases and prevalence means number of old and new cases. So if there is a something, say prevalence of hypertension is 10%, suppose, and incidence is 5%, prevalence of diarrhea is 5%, and incidence is 15%. So here we can see incidence of diarrheal disease rate is high. So for the betterment of the nation, we should use more money in the diarrheal disease. So if there is incidence rate and prevalence rate, you should more focus on the incidence rate. Incidence rate shows the current condition and prevalence rate shows as a whole. And we should give more focus on the incidence rate because it shows current condition. Lastly, the time period is little bit short and I cannot describe all the part of this epidemiology and research writing. But if you want to learn more, and the easy way, I have a YouTube channel. It is a Rosen Life and Living. You can see there is a channel link and you can find in the YouTube where you can see I am just started my research methodology part, epidemiology part. You can uh, show the videos or see the videos and you can learn easily from there. And I also have a Facebook page and this is my personal email. You can email me if you want to learn more about the epidemiology. Am I want to serve you and that won't be a problem for me. I will send you any question if you want to know about epidemiology, research methods. Then if you want to apply higher study abroad, anything about scholarship, you can ask me. And in my channel, I am providing that. So I hope you will watch my channel and subscribe it. And if there are any question, just email me in here. And this is my personal email. And thank you for your participation, and that's all from me. And I also thank the BIMSSCON for giving me this opportunity to share my knowledge with you. Thank you all and wish you good luck and be happy and be free from this COVID and use sanitation and mask. That's all.